Good morning, everyone. It's Dr. Angela, and we are coming on today with a special guest again so that we can talk specifically about tonsils and adenoids. We've all heard about little ones, and so we're going to have some really good information. My name is Dr. Angela Aberg, and I am a pediatric and prenatal focused chiropractor in Escondido, California, and I will let Jenae introduce herself.
Hi, I'm Jenae, and I am an orofacial myologist and breathing specialist, and I work with kids and adults on breathing and the muscles of the head and neck.
Oh, that is awesome.
Yeah.
And that's why Jenae and I are together today, because she's got a really good handle on what's going on here. So I've got some questions, and we're going to tackle this tonsils and adenoids. So we've heard the term, and you've used the term before, obligate nasal breathing.
Yes.
We're going to start this off. So tell us about obligate nasal breathing.
So we are all born obligate nasal breathers. Babies are born learning or knowing how to breathe through their nose so that they can breastfeed, which is the way a baby gets their sources of nutrients when they're little. So we need to be able to breathe through our nose so that we can functionally breastfeed as babies. So we are all born obligate nasal breathers. Our nose filters our air, warms our air, humidifies our air, and produces something called nitric oxide, which is a very important gas that's produced within the nose and the sinuses that helps filter everything, and it's a natural vasodilator and an anti-inflammatory. So what that means is it keeps the nose and the sinuses open, and it keeps inflammation down. So our noses are, I always say, our nose is our breather, our mouth is our eater and our talker. We should not breathe through our mouth, ever. And as babies, we're born obligate nasal breathers.
Oh, so obligate means that's just the way it
That's
happens,
the way
right?
we should
When
breathe.
babies are born, they know how to breathe through their nose so they can latch and nurse and be able
Correct.
to take their nutrients.
Correct.
Awesome.
Yes.
So then if we see an adult who's not breathing through their nose, they've lost that somewhere along the line.
Exactly.
Right.
Adults and kids, because
Okay.
nasal breathing can be lost at any point in life.
Right.
And so the younger that happens, the more inflammation that's present, the more solidified that mouth breathing habit is. But really, I see mouth breathing habits in all ages. It can happen very early on in an infant's life, even. So I work with parents watching for signs and symptoms of mouth breathing and then teach them how to change that. The younger, the better.
Yes, and that conversation about nitric oxide
Yes.
and inflammation is
Yes.
huge. We hear stories about inflammation everywhere as it relates to other different types of chronic conditions that people
Absolutely.
have. Yeah, so this
Yes.
is huge. So question number 2, why do the tonsils and the adenoids get enlarged? So why do they get enlarged?
Well, there's multiple things that can create an inflammatory state within the body. The piece of the puzzle that I work with is the breathing piece. So one of the things that can create an enlarged lymphatic tissue back here, and the tonsils and the adenoids are lymph tissue. They're actually lymphatic or lymphoid organs. So they're back there as the first line of defense for the immune system. So when they get enlarged, I look for mouth breathing. And if there is a mouth breathing habit, then that can create inflammation because the mouth doesn't filter like the nose does, and the mouth doesn't produce nitric oxide. So what happens is we're breathing in everything in the environment without infiltration. The nose is supposed to filter everything as we breathe, but the mouth doesn't do that. So if there's a mouth breathing habit, we're breathing in all the bacteria, the viruses, the dust, the pollen, the grasses, all of the things that people react to. If we're breathing through the mouth, it's going to react more. So that can create enlarged lymphatic tissue in the back. So we've got our adenoids, our tonsils. There's tubal tonsils that go from the ears to the back of the mouth, the lingual tonsils on the back of the tongue. So all of those can get really big and inflamed and create an airway obstruction.
Interesting. So our mouth should be closed. We breathe in the air, and the air goes up through the nose, and that's our warming, moisturizing, and then that's signaling. So it can signal those lymphoid organs back there and start that immune response.
Yes,
right.
absolutely.
And if we're breathing in through our nose, then that's the proper direction for it to go so our immune system can get the right signaling.
Absolutely. Yes,
Right.
that's exactly right.
Awesome. Okay, so the enlargement then, where does the enlargement come?
So inflammation.
Inflammation,
So,
okay.
Bacteria, viruses, dust, all of that can create an inflammatory response. And when we see enlarged adenoids and tonsils, which are the ones most people talk about, we need to look at what's the cause of inflammation. I'm always looking at targeting the cause. Another thing that I always say is we're not born with extra parts. So if we can keep these parts and help them work for us, it's always going to be better than cutting them out. So, and I've seen a lot more let's wait on surgery. I've heard that, come back from specialists. Let's wait, but let's not just wait. Let's do something about it. Let's get them to shrink. Let's get the functional systems in place so that we don't have to take them out. We can start to reduce the size and we can start to increase function so that we're increasing our immune response. We're helping kids get healthier so they don't get sick as often. We're helping them sleep. Most kids with swollen tonsils and adenoids have sleep issues. They snore. They have witnessed sleep apnea events where they stop breathing. So we want to make sure that we can reverse all of that and not just wait until they get bigger because we're not addressing the functional system.
Right. Okay.
Yeah.
Awesome.
So
that answers the question.
Okay.
And then, so let's say they're going through a little immune challenge and they're swollen. So then we just use the strategies that we can teach, that you can teach.
Yep.
And then we let the immune system roll through the challenge.
Right. We want to increase the functional systems. So we want to correct the functional systems. So what I do is I work with breathing. I work with static and dynamic function of the muscles of the head and neck, and I work with sleeping. So those things we do all day long. We breathe all day long. We rest our mouth all day long. We swallow about 1,000 times a day. Some doctors would argue more. And we eat multiple times a day. And we sleep every single day. So these are functional systems that we need to work on to make optimal so that we can function optimally in this life. And so we're trying to optimize functional systems, daily function, so that we can fight off whatever approaches us. And kids are wonderful little petri dishes for bacteria. So we want, and it's the immune building time in their life. We want to build those immune systems so they're strong, healthy adults. And if we can teach these things young, we can build strong, healthy adults. But I also work with adults. So sometimes these mouth breathing habits form at any time in life, and I also work with adults to help them increase their immune response.
Awesome. Good. So helping people through a challenge doesn't have to just be a wait. There can be lots of things to do.
Absolutely.
For instance, in our office, they would get an adjustment, right? And we'd also talk about nutrition and vitamins. And then now we have another tool in our tool belt where you can issue and give and teach certain activities and muscle exercises, let's say, that people can do during that time.
Absolutely.
To get the little immune challenge to go away faster and to improve the function of all of this swallowing mechanism, breathing mechanism.
Yes.
Awesome.
So physiology, good, healthy physiology of the muscles of the head and neck is the tongue resting in the roof of the mouth, suctioned passively to the roof of the mouth. And when we swallow, the tongue should press into the roof of the mouth and the back of the tongue should go up and back. And the reason why that's so important as it relates to tonsils and adenoids is that our lymphatic system works with a series of squishes, okay? Muscle squishes. So the diaphragm is a squish that should happen when we breathe. So when we breathe, we should breathe from our diaphragm. But another big squish that I work with is the back of the tongue having the ability to go up and back and squish that lymphatic tissue to drain it so that we can get that lymphatic system moving to help filter everything and get the immune system to function at a higher level.
Oh, that is awesome.
So when
squish.
you squish, we want it to squish. It's a series of squishes. So when the tongue is low in the mouth and the lips are parted, the tongue is weak. The tongue is 8 muscles. It's a set of 8 muscles. It's an organ, and it works in a coordinated fashion to help us do all kinds of things. And one of those things is the tongue needs to go up and back to squish that system to get it moving. And this relates to ears too. So I've got lots of kiddos that come in with multiple sets of tubes and they're not working, but if I can get the back of the tongue working to squish that tubal tonsil, I can get the ears to drain. Which is what the tubes are supposed to be helping them with, but their functional systems of everyday life are off, and so it doesn't work.
Right. So there is a way to drain the ear from the inside, that correct function of that tongue up on the roof of the mouth and then back and squishing those tonsils. This is awesome. Okay. So what is biofilm? I've heard you talk before about biofilm. Talk about biofilm.
So biofilm exists throughout the body, and it is a thick gelatinous matrix of bacteria, highly sophisticated. It has all these networks of systems if you look at it under a microscope, and it's thick and it feeds off of itself and it brings more bacteria in, and it eats and brings it, it gets more and more robust. So it lives in a warm, moist environment. I worked with biofilm in just this area for years because I started off as a dental hygienist, helping people get rid of plaque, which is a biofilm, and help get rid of cavities, which, by the way, when you close your mouth and breathe through your nose, cavity rates go down. So I am working with kids to never get a cavity.
This is awesome.
Yeah, so I don't want kids to ever experience decay. And if I can get their tongue up and their lips closed and teach them about biofilm and teach mom and dad about biofilm and how to get this under control, no cavities. So we want to get kids to never have a cavity. I've never had a cavity.
Awesome.
Yeah. So, and I grew up with dental parents that taught me this from a really young age. So I've taken those and I put them into my practice. So I help kids with that too. But a biofilm I've worked with here forever. When I started working with breathing and the nose and the sinuses and the ears, I also encountered a biofilm. And so a biofilm is a thick gelatinous matrix of bacteria that's highly sophisticated and not much breaks it up. So we want to use natural sources to break up that biofilm over time. And it does take time. But when you mouth breathe, you build a biofilm in the nose, in the throat, and we need to clear that in order to get a clear nose and be able to use these systems. When the body doesn't breathe through the nose for a very long time, the term, if you don't use it, you lose it, comes into play. So the body actually forgets how to breathe through the nose. So I hear a lot of people talking about the importance of nasal breathing right now, which is super important, but I have a lot of patients coming to me saying, but I don't know how to. I don't know how to breathe through my nose. People are talking about how it's important, but how do I do that? And so that's what I teach.
Great. So biofilm, we have a healthy biofilm and then a not so healthy biofilm. Is that right?
So when we mouth breathe, we're not getting all that filtration. So the bacteria that we're breathing, the viruses that we're breathing, settle into this warm, moist environment and create this thickness, this mucus that can't really be cleared. So we need to clear it. Because
normally our membranes are moist, but there's no film. There's not that big biofilm.
Right.
Okay, so biofilm is more negative than in a not working well situation.
When we're mouth breathing, we're not getting all the filtration the nose provides, and then it gets not healthy.
Right.
So just like plaque in the mouth isn't healthy, it's there for a reason. We want to clear that biofilm too, because we don't want plaque to create an acidic environment, which creates cavities. Which, by the way, breathing through the nose changes the body's pH. It changes the chemical axis.
Your whole body.
The whole body.
Wow.
Yeah. So if we can get the nose to breathe for us, we are going to actually breathe less. We're going to retain more CO2. We're going to produce more nitric oxide. We're going to depress histamine levels. So a lot of kids that have high reactions to environmental things, those reactions go down significantly or disappear. So we want to help our chemical axis by breathing through our nose because we are changing the entire chemistry of our body.
The entire chemistry of the body. That is amazing. So it's not just right here, it's affecting our entire physiology.
Yes. Think about this right here as the symptom.
Yeah.
Okay. So this is, if these are inflamed.
The tip of the iceberg, right? Yeah.
We want to target the cause, of the problem, because just removing this here is not the answer.
Right.
I've had so many kids come in with tonsillectomy, adenoidectomy, tubes, that it wasn't successful. They still need to work on those functional systems. I've had so many kids that have come in with their tonsils out they're still mouth breathing, and now they have chronic asthma because they have no filtration left. That was their one source of filtration, which was huge for a reason because they were breathing wrong. And now they're on inhalers and things like that because the air is going straight down to this very sensitive lung tissue.
Right. So still changing so that they can become that nasal breather again is still hugely important.
Absolutely.
Okay.
Yeah.
Good.
So whether or not somebody's had those filtration systems out or they are enlarged, we've got to work on breathing. We've got to work on that back of the tongue squish, that tongue being sealed in the roof of the mouth so that we can get the lip closure so that we can function correctly.
This is awesome. Yeah, so some strategies, some couple at home things to do for moms for shrinking tonsils and adenoids.
Yeah, so I create a lot of awareness in young mothers to look for lips parted. Because oftentimes moms come in with their kids or their babies or even an adult patient that comes in and they don't think they're mouth breathing, but if the lips aren't closed, there's a mouth breathing tendency. So if they're just slightly apart, so I'm not talking open, I'm just ever so slightly, that creates enough of a mouth breathing problem and it signifies a low tongue posture. So that's that weak tongue that can't go up and squish. So I educate moms to look for this, to look for those slightly parted lips as a sign and to listen for breathing. So breathing should be quiet. You can't hear it, you can't see it. So if you can hear somebody breathing or if you can see somebody breathing, then that is something that we need to address right away so that we can train that body how to function better. So really, it can be complex on how to address this. So I can't really give, just do this. But if you can look for the signs and the symptoms, then you can be aware and then get it right when it starts. And sometimes with little ones, we just need one visit to help clear the biofilm, to get the tongue in the roof of the mouth, to get the lips together. Just some simple things that you can do really young to help this not become a habit. And then the older you get, the more that needs to be in place.
And then as the child grows, they never lose that nasal breathing. They always keep that nasal breathing. And when they're not speaking or eating, then their lips are closed. And that's a good evidence to know that this is happening.
So really, I try to get parents to look for, when you go into the room and a child is sleeping, you should not know they're in there. It should be completely silent, like nobody's in the room. If you can hear it and you can see that the mouth is open, if there's any audible breathing at all, it doesn't have to be snoring, but if there's any audible breathing or the lips are slightly apart, then that's a sign of dysfunction, and that leads to swollen tonsils and adenoids.
Got it. Okay.
Yeah.
This has
so
been
looking
huge.
for those things, getting the advice, the earlier the better, but at any age, this can change and this can improve. And it just, when I do a functional assessment, I'm looking for these functional systems and I'm targeting those within the therapy so that we can, and it's very individualized because we're all unique individuals, but we're targeting those things so that we can get change over time.
So then you do an assessment and then you can know where somebody's tongue is not strong, in what position. You talked about swallowing, you talked about just resting with your tongue on the roof of your mouth and your lips closed, and that breath should be coming here. So there's plenty of assessment to do for each individual person. So there's no one size fits all. It's all an individual evaluation assessment. And then specific exercises that help that person start to breathe correctly and hold their tongue correctly.
But what I want to empower parents to do, and just as an individual, if you're an adult that has this, is give you the knowledge of what to look for. Because unfortunately, I have not seen any referrals from a pediatrician about this. That the pediatrician says, oh, this child's, has his mouth apart or lips apart. So it's very rare that I'm getting referrals for this. I really want to help parents know what to look for and what to point out on your own so that you can know what to do at a young age so that we don't have to go under general anesthesia and get these organs cut out. We want to save them because they are our fighting immune system so that we can be strong individuals and fight everything that's out there around us.
Absolutely. And a good first alert for our immune system to get that process going. I think we looked at an article that talked about it stimulates B lymphocytes and T lymphocytes. So it stimulates the deeper immune response just from that first signaling from breathing in through the nose.
And if we're breathing through the mouth, no signal.
Not happening.
Yeah.
Yeah.
And
So despite the tonsils, we're talking about our whole immune system.
Yes.
Yeah.
Absolutely.
Being able to function.
The entire immune system, the entire chemical axis, and then sleep. If a child can't sleep and they're obstructing during sleep, we grow, we heal during sleep. So sleep is so important in a growth phase for children and as adults. We heal during our deep phase and REM phase sleep. So if we're not getting those healthy sleep cycles and we have any interruption with breathing, which is what causes the sleep apnea, is a pause in breathing. You know, that is what sleep apnea is. So if we have an obstruction back there and we're not getting into those deep sleep cycles because the brain has to wake itself up, not physically awake, but arouse. It's called an arousal, taking your body out of that deep sleep to wake itself up to say, hey, breathe, breathe. You're not getting into those healthy sleep cycles. And if you're not getting into those healthy sleep cycles, you can't heal.
Right.
So sleep is a big part of our immune system and our healing ability. So we really want to look at all of these daily functional systems.
Yeah. This is awesome.
Yeah.
This is so great. So tell people where they can find you.
So my practice is called oral posture. Oral, and then the way our mouth rests, posture. And you can find me at oralposture.com. I have several therapists working in my practice, and we do free 1-hour assessments. So that helps us be able to get the knowledge out there and talk about how important this is, and then also do a really great assessment so that we know what the program is to suit each individual's needs. And yeah, so you can find oralposture.com, oralposture@gmail is my email, and you'll contact me directly and I'll answer.
That sounds good. Hey, thanks so much for listening in. This has been hugely valuable. Good. Thank you so much, Jenae.
Good.
And for our office as well, you can find us at EscondidoHillsChiropractic.com. Thank you so much for tuning in. We know it takes time to learn all this, but we believe it creates a more empowered mother and father and a healthier family.
Absolutely.
So have a great day.
Yes. Bye.